reducing deaths, protecting health workers and developing a vaccine. Those are the priorities of the World Health Organization set out as we go on air after a two-day meeting of health experts in Geneva. They put together a global call to action to tackle coronavirus, which they've now renamed COVID-19. Our health correspondent, Victoria MacDonald, is in Geneva. And Victoria, we'll come back to that meeting in a minute. But first, if you could just bring us up to date on this breaking news about the first case in London, please.
Yes, we understand that it was a woman from mainland China who flew into Britain and who is currently on her way to St Thomas's Hospital in South London, where they have a specialist centre. That is as much as we know at the moment. It was always expected that we would get cases here, and the public health system is set up very well, so we're told, to be able to deal with this.
And now what about the WHO meeting that you've been listening into?
Yes, they've spent two days with more than 400 experts putting together a blueprint, a roadmap, so that they don't have any gaps. They want to know where the research should be. They want to know how they can prevent deaths, what sort of vaccines need to be developed. They say that they've got 4 vaccines that are potential, and maybe 2 of those might be in human trials within a few months, though not anything ready for maybe 18 months. What is critical is that they have put together this plan, because in the past there have been gaps. This is what the Director General had to say just now.
As we speak, research groups are meeting with the leading research funders to start work immediately on the most pressing questions. Some of these issues include easy-to-apply diagnostics, the best approach for infection prevention, potential therapies that could be used to treat patients, existing vaccine candidates and how to accelerate them, and how to address the infodemic.
You can see there are a number of questions that they have to answer, and there are numerous questions that are unanswered. Not least, why have there been no cases reported in India, Indonesia and Africa, all places where there is a lot of movement between China? So there are questions, queries, worries actually that there haven't been any reports. But this is how the day and the last 2 days have unfolded.
When they went into hospital, they were diagnosed with novel coronavirus pneumonia. Discharged yesterday, they are cured, and the disease is now called Covid-19. Not much else has changed, though. Experts still don't have the answers to some critical questions. How contagious the virus is? Can it spread without people showing symptoms? They're even unclear on the death rate. So scientists meeting at the World Health Organization in Geneva have developed a blueprint to help speed up the information they need and to develop medicines to vaccinate, treat and cure.
This meeting is a direct result of lessons learned during the West Africa Ebola outbreak, because while they were eventually able to develop a vaccine, they also found that they had huge gaps, particularly in research and development, and they don't want that to happen this time.
The blueprint outlines how to mobilize international action, produce a global research agenda, accelerate the development of medical products to control the outbreak, and increase the understanding of the disease.
I'm sure that everyone feels terrible that so many lives had to be lost in the West Africa Ebola outbreak before we could get our act together. We don't want to see that, and in fact even the deaths that are happening on a daily basis in China, you can see that everyone feels bad about that and wants to do something to stop it. So it doesn't matter which country is affected. Somehow there seems to be now, at least in the scientific community, a desire that a global public good is something that's driving people.
Information from previous coronavirus outbreaks like SARS in the early 2000s means vaccine developers are not starting entirely from scratch.
People are dying as we speak or have already died, so it's never timely enough in an outbreak session. What I see, what I hear, what I feel, what I also feel myself, is that people are doing really the very best and beyond to be as quick as possible with the learnings from other outbreak situations in the past, like H1N1 or Ebola. This is being integrated so that things can go much quicker now.
Room service with a difference, protection suits, delivering food and temperature checks. This is a hotel in Hubei province currently in quarantine. The Chinese authorities are claiming that overall numbers of new cases of Covid-19 are falling.
The daily number of new confirmed cases dropped to 2,015 on Tuesday, from the peak of 3,887 recorded on February the 4th. The daily number of new suspected cases has also lowered.
But medical experts are cautious, saying there are too many gaps in the data to know how meaningful this is. And in Wuhan, the numbers remain overwhelming, with reports of the authorities requisitioning private hospitals, hotels, apartments, cars and even face masks. So far, more than 45,000 people have been diagnosed with Covid-19, and there have been 1,117 deaths. The numbers outside China remain tiny, but containment is everything, stopping its spread while scientists seek the prevention and the cure.
Victoria MacDonald reporting from Geneva there. So as we've heard, it's been revealed in the last hour that a woman who flew into London from China a few days ago is being treated for coronavirus, bringing the total number of UK cases to 9. She reportedly developed symptoms after landing at Heathrow and is now in a central London hospital. Meanwhile, health officials in Sussex say that they've traced all close contacts of 2 GPs who've been diagnosed with the illness. Several schools in the Brighton area have said that parents can choose to keep their children at home. Aisha Tal reports.
A community watching closely but calmly. In Worthing, in Brighton and Hove, people are taking precautions and asking for more information on Covid-19, known as the coronavirus. And here in Worthing, one of the 8 confirmed UK cases works in the A&E department of this hospital.